Basic care and comfort is very, very broad on your NCLEX. I think the best way to learn it is to pay attention to the key concepts. And so I'm making them in a question form to show you some of the key points. It's easy to point out in that way. It's very difficult to do a very complex lecture by question form with the key facts. So let's do 20 questions and see how you do. And they're straightforward. I will show you key facts. As you already know, I like buzzwords, so that's what I'm going to focus on. Which of the following the nurse should expect, I underline expect, to be prescribed for the client, right? The client is on the message word after word, hemorrhoidectomy. That's all. Which of the following the nurse should expect to be prescribed for the client? I've said it multiple times. When I answer a question, the only formula I use is to break down the question. What I'm being asked is an expect that will be prescribed. So that's the asked question. What is the case? I have hemorrhoidectomy. And what are my buzzwords? Are always the asked and the buzzwords, right? And therefore, I just rewrite the question the way I think. I just had hemorrhoidectomy. What is the doctor going to prescribe for me to help with the problem? And bring your content. Hemorrhoidectomy. The patient had hemorrhoidectomy. Right. Right. What is going to help with comfort? You take a bed bath. This is somebody in bed that cannot move, and you do a bed bath on them. Shower, you're standing up and the water is running on you. Sitz bath, you put your perineal, okay, in that water, or the vapor from the water is going to numb those areas and help with the pain. Tepid water bath, it's just a bit warm water bath. Sitz bath is your best friend when you need a perineal pain management. That's why when a pregnancy had a baby, it's a perineal problem, we do sitz bath. That is the way you answer question. Pick the buzzwords, pick the question apart, and it will become easy for you. Second question, same thing. What is the next best? It's the best action. Whenever you see best, it's always a priority. Next is always a priority. Action, I need to do something. And next is caring for a client who just had what? Bowel movement. He just had a bowel movement on their what? Bedpan. Client is what? Immobile. I cannot move due to stroke. What is your next best action? Rewrite the question. Patient just had a bowel movement who does not move on the bedpan. This is the patient sitting on the bedpan. Okay, just had a bowel movement. I know it look crazy drawing. What would you do? He's just sitting on the bedpan. He can't move. You put the bedpan. There's a reason why you put the bedpan under the patient. Help the client to the bed. Is that important? Provide privacy. Is that important? Provide perineal care. Is that important? Call housekeeping. Is that important? I just had a bowel movement. Will you help me into the bed? Of course, I'll help you onto the bed. Is that important? Don't you clean the patient before you put them on the bed? Provide some privacy. That privacy should have been provided long time. Provide perineal care. He can move. He has stroke. He can take care of himself. If you put him on the bed, you mess up the bed. Provide some perineal care and then take care of it. Housekeeping will not be happy with you. So 3 is the right answer. Number 3, what we have, select or apply, right? And this is teaching new graduate about the common pressure injury location. Common pressure injury locations. Which of the following the next should include in the teaching? What is the question I ask you? Where is the common pressure injury location? That's all. Where is the pressure common injury location? The sacrum is 1. Your left atrium is 2. The trochanter is 3. Your elbow and the flank. Those are the areas you can see. They all have bony prominences. That's why they have higher pressure injury. These things. So those are the places you pay attention to. Those places that have a lot of bony prominences are areas with higher pressure injury. So these are 5 you have to know. We always talk about sacral DQ, but you can have pressure in your elbow, on your side. People lay on their side. The trochanter hip. When you lay down on these bony prominences, most of the weight is over there. So that's why the pressure, they are the most common pressure injury site. Number 4, best care and comfort. Which of the following position the nurse should avoid placing the client? A nurse is caring for a client with what? Braden score of 8. That's all. That's all I give you. You have to make sense out of the question. You take the Braden score, which is buzzword, is 8. That is the problem. Anything less, like these numbers, it's not good. Right? You want your Braden score to be very high. Less than 12 is a problem. So this one is 8. It's a problem. It's really, really, really high risk. This is a high risk problem. Therefore, this patient is high risk of what? Pressure injury. If I'm high risk of pressure injury, yeah, don't put me in a place where most of my body weight will be on the bone. When you put them on the prone position, the body weight is distributed in the whole body. So they can have pressure injury in their mouth, in their forehead, okay, in their knee and the other thing. But the weight is distributed. So those areas are risks of all of them. Supine too is the same thing. If you put the patient supine, the whole back the weight is distributed throughout the back. If you put them in what? Lateral at 30 degrees is also what? Very good. This is the best way we want to put them. This is the best way. 30 degrees lateral is the best. This will prevent, okay, pressure injury. Is the best way to prevent it. The following position the nurse should avoid placing. The most highest risk is when you put them on their side. When you lay on your side without bending 30 degrees, most of your weight is on your trochanter, okay, on the side. That's where you get more pressure. All your weight is on the bony premises. There is no distribution anywhere anymore. So that's the biggest problem. This one, they will get it, but it's distributed completely, though, so their injury is not that bad. Just by putting on their side, the injury is so high, it's a problem. And so all the weight is on the left side, on the lateral, whatever side they laying. So side laying is bad. Number 5. The nurse is caring for a client with what? Severe stertorrhea and a large voluminous diarrhea. Which of the following vitamins replacement the nurse should question? Keywords. Vitamins I should question. Patient has a lot of diarrhea, fatty diarrhea, and a large amount of it. Bring your content. If I'm having fatty diarrhea, what vitamins am I losing? Think about somebody with cystic fibrosis. Classic. If I'm having fatty diarrhea, I cannot absorb fat. What are the fat-soluble vitamins? A, G, E, K. These are fat-soluble vitamins. The red is fine. If it's water-soluble, it's not affected. A is affected. E is affected. D is affected. This one, the nurse should question. There's not going to be a problem with that. Okay, that's the way you answer this question. Number 6, sorry. Which of the following teaching is the next which of the following teaching the nurse should provide at discharge? Which of the following should provide at discharge? A nurse is caring for a client with gastroesophageal reflux. What teaching do you provide? Lay down for 30 minutes after eating? No, that's not good. It's not a good teaching. If you lay down, you're going to reflux. Drink at least 8 ounces of water with meal. No, you should not drink with your meal in between the meal, so that you don't your abdomen doesn't get distended and reflux. Minimize caffeine intake. The word minimize is completely irrelevant. You want to stop caffeine because caffeine will decrease your lower esophageal sphincter. It's this sphincter that causes reflux. So you should avoid caffeine, alcohol, and tobacco. That will lower the esophageal sphincter, and that will increase your reflux. If you remain upright for 1 to 2 hours, yeah, that will push food down, less reflux. So this the next will do. Number 4. I'm trying to break down the question for you. Okay. Number 7. Which of the following the nurse should include in the plan of care due to client condition? A nurse is caring for a client with what? Moderate hearing impairment. This is the patient, and they can hear well. Okay. What would you do? Moderate hearing impairment. Decrease background noises. Yes. So that they don't have to hear the churning noise of the ventilator. Ensure well light environment. Somebody will say, oh, they can see. No, these patients, because their hearing is bad, they depend on the senses of vision. So they look at your mouth and they read your mouth. So ensure well lighted so they can see your mouth. Ensure natural movement of the lips. The same thing. If you try to enunciate the word and you are not natural, the way you speak, they will see your lips moving a certain way. They can't figure out the words. Position self in the line of vision. I told you, if the hearing is gone, my vision is my friend. I can hear with my eyes. So let them see you and they can read your mouth. Drop the tone of your voice. No, just keep it the way, normal tone. Speak the way you used to speak. Don't change the voice. So 1 to 4 is your right answer. Number 8. The client, so which of the following is appropriate based on the prescription from the back? The client arrived on the med-surg ward after laparoscopic cholecystectomy, after laparoscopic appendectomy. The prescribed diet was clear liquid. Which of the following is appropriate? Straightforward. Rewrite the question. They removed the appendix, so appendectomy. They have been giving what? Clear liquid. Which of this is a clear liquid? That's all. Apple juice, excellent, but they should not have a pulp. So fruit juice without a pulp, there's a pulp there, so that's just wrong. Tea is fine, but with cream, there should be no milk in clear liquid. So that one is wrong. Chicken broth, yes, that's the broth. Chicken noodle, if I put noodles here, soup, the noodles make it what? Not a clear liquid, but this is chicken broth, this is good. Clear soda is fine, so Sprite is okay. Cranberry juice is a juice without a pulp. Coffee is fine, is allowed. So 3, 4, 5, and 6 are your right answer. Okay, coffee is fine. There's no milk in it. Cranberry juice is a fruit juice. Sprite is clear soda and chicken broth without the ingredient in it. Those are your friends. That's the clear liquid diet. Okay. Number 9. Which of the following the nurse should teach the client when using crutches? Okay, teaching. The client has a complete paralysis of his hips and the legs. This is the patient. Okay, the hips and the legs, that's not work. Nothing is working. This is like similar to amputation. I've been amputated. What you use when both legs is amputated, or one is amputated, the other one is short. What do you use? You don't use 2 points, you can't stand on it. You don't use 3 points, there's no leg to stand on. Even this patient has legs, but he's paralyzed. He can't do anything. He can't support it. 4 can support it. You got to do a swing through. So that's what you should use. Swing your body through. Number 10. Which of the following regarding the use of walker is appropriate? Walker, right? I have 2 walker, right? Which one is appropriate? The client was prescribed a walker due to right leg weakness. My right leg is weak. For to using walker, the best way is first move the walker. Okay. Then bring the affected leg and the unaffected leg. So this move the walker, that's good. But unaffected leg is wrong. You got to move. If you do that, now you're standing on the affected leg, you're going to fall. Affected leg move first. You can't support yourself on that. Move the walker. Affected leg, you being supported by the unaffected leg, then you move it. So this sounds better. This move the unaffected leg, and so the walker and the affected leg is done. And then you move the walker, but then you'll be standing on an unaffected leg. You'll be, you already moved the unaffected leg. You can't move both of them twice. What happened to the affected leg? You can't do that. So number 3 is your right answer. These things, you have to think about it multiple times. Number 11. Which of the following indicate correct understanding of the teaching? Teaching is correct. A nurse is providing teaching to a client with colostomy on food choice to prevent loose stools. I say pay attention to the buzzword. I have colostomy. What is the problem? I'm having loose stool. So which of the following indicate correct understanding of the teaching by this? I'm providing you information about food to prevent loose stool. Asparagus give you too much gas. Spicy food speed things up. Raw fruit and vegetables speed things up. Yogurt and banana, they thicken things up. So these 3, no, raw fruit and vegetable will make you go multiple times. So it will be diarrhea. Spicy food the same. This will give you a lot of gas. So these 2 indicate correct understanding. That's what you should be eating. Yogurt, banana to prevent loose stool so that you can thicken the stomach. Number 12. Which of the following indicate correct teaching by the nurse? A client presented to the outpatient clinic due to excessive what? Flatulence. A lot of gas. Flatulence. Okay. Which of the following correct teaching? So, client presented to the outpatient clinic due to excessive flatulence. Teaching was provided. Which of the following indicate correct understanding by the nurse? What do you think? They wanted to They provide a teaching because I'm passing too much gas. I need to do something to stop it. Cauliflower, a lot of gas. Carbonated drinks, a lot of gas. When you're chewing gum, you're swallowing a lot of air. When you're drinking from a straw, you taking in a lot of air. And beans produce a lot of gas. All these things will make you pass a lot of gas. Therefore, those are all answers. Somebody will say limit, sometimes avoid. So it depends on the language. I intentionally use the word limit, but all of them will give you too much gas. You shouldn't stop chewing gum because you're passing a lot of gas. You can limit it, not too much. We're supposed to pass gas. That's why I use the word limit. You can eat beans just because you pass gas. You shouldn't eat beans. You can limit the amount of it. Okay. Number 13. Which client should be seen first after medication administration? So who should be seen first? A nurse is caring for 4 clients. The nurse administers pain medication to each client. Who should be seen after you've given the medication? Break it into 2. Client with left leg X-fix. So he had surgery 6 hours ago. We put the X-fix there. Client just had exploratory laparotomy 6 hours ago. Client with the chronic back pain admitted 6 hours ago. Client with the sickle cell vaso-occlusive episode admitted 6 hours ago. So who are you going to see? They all have pain. You give them medication. Who are you going to see? The key word is seen first after administration medication. After you give it to them, whoever you think is going to have ongoing problem that is going to progress. These people will fix their problem. They're going to have some small thing. He has just had surgery in the abdomen, going to have some pain. Chronic pain is chronic, nothing you can do about it. But sickle cell patient can progress when they are in crisis. This is a crisis. When you're in crisis, things can happen. Tissue can die. So you got to see them and see. So for us, they're having vaso-occlusive episodes when they are in the hospital. That means tissue are dying. So they are the one you see first. This prioritization, but based on content. 14. Which of the following the nurse should recommend? Select or apply. A nurse is caring for a dying client. Word dying client. Client has a very loud, deaf rattle sound. Which of the following the nurse should recommend? When people are dying, their saliva secretion, they swallow it, and it's at the back of their throat, and they make noise. That's the rattle. It's very scary for the family. It's like a rattlesnake. That's that sound. That because they're dying on their saliva, they're choking on it. The nurse can turn their head, raise them up. Sometimes they can give them medication. Which of these they should recommend? What I encourage you, look at it and see if there's a similarity between them. What is this? Physiostigma. We block acetylcholinesterase and increase your acetylcholine. Diazepam decrease your respiratory rate. Scopolamine is anticholinergic. Atropine is anticholinergic. Betanacol is cholinergic, so increases HCH. So you have 2 cholinergic, 2 anticholinergic, and 1 decreasing in respiratory rate. Of course, we don't want to decrease their respiratory rate. That's good. Do you want them to make more secretions? No. No. Therefore, you should take away the cholinergics, and your answer choice is 3 and 4. That's the way you approach questions. It's all content. Like I told you, use your content to figure it out. Okay. Number 15. Which of the following the nurse should include in the plan of care? Include in the plan of care. A nurse is caring for a dying client. client has refused to eat for 3 days. Like I told you, these are our concepts I want you to know. We talk about the deaf dying with the rattle. These are key questions they like asking. And then whether the dying person like to eat food. Most of the time, when you die, your body does not want to feed a dead body or a dying body. So the patients are usually anorexic. They don't want to eat. It's protective to them. They don't want you to know they die. They can see death. There's no way to feed your body. So they will become anorexia. Okay, that is fine. You don't need to shove food in their mouth. So there's no need to recommend you to feed. I'm trying to trap you to know that percutaneous endoscopic gastrostomy, this is what we call PEG, is also a feeding tube. It's a tube through your stomach. That's the example of that. Therefore, if one is wrong, this has to be wrong. You cannot physically feed them. They don't want to eat. It's protected to them. If they refuse to eat, fine, but when they leave them, when they're hungry, they will eat. You can't force them. So this is the best way to do it. You can also check their mouth, oral care, and make sure there's nothing preventing them from eating. Brush their teeth or bring food from home. They may like it. So those are strategies you can do to help a dying patient. Number 16, select or apply. Which of the following the next you include in a plan of care to avoid complication? A nurse is caring for a client with Y count of 3,000. Break it down. Your WBC is 3,000. It's less than 3,500. That means you have what? Neutropenia, very low. What is your problem? Precaution, neutropenic precaution. Who needs neutropenic precaution? Somebody who is at risk of infection. Therefore, private room is good. Every visitor wear a mask. Hand washing is the best way. Limit number of visitors. Raw vegetables is bad. They're going to get sick from it. So no raw vegetables. Therefore, 1 and 4 are your right answer. This should be straight. Okay. So this is basically asking you a question about neutropenic precaution, and I give you the numbers. I did not want to tell you that, but I want you to interpret it and say, hey, this is a neutropenic precaution. Okay. Number 17. What do we have? Which of the following statements from the client need further teaching? After providing teaching to a client about sleep hygiene, which of the following statements from the client need further teaching? I will keep the light in the bed dim. That's good. I will keep the temperature on the cooler side. Yeah. I will keep the TV off completely. You got to pick last because this is all normal. I'll keep my dinner close to the bedtime. What it means is if you eat a dinner, then you go and sleep, you eat in large meal. You should not eat the large meal before you go to sleep. So this one needs better teaching. If the room is cold, yeah, good for you. TV off, no noise. You don't go until you're ready. The room light should be there. And use the bed as sleep, not to go and read. So don't go onto the bed until you're ready to sleep. Key hygiene problem. Number 18. What is the next best action? After a change of shift, okay, change of shift, the incoming nurse reviewed client orders and saw that wrong dose of morphine was given at the end of the last shift. What it means? You came in, you get a sign out of the patient, and then you go and review the chart. You realize, oh, a few minutes ago, he did receive large dose of morphine. What would you do? Critical thinking. Do you call the nurse immediately? You notify the risk management, evaluate the patient, or document the find? Why would you document the finding if you know they get a wrong medication? What would the nurse do who has gone on? What else can she do? Risk management, you want something to happen before they do that. So why would you report this patient to risk management? You got to follow chain of command, COC. So go assess the patient. Assess the patient. It's your priority. It's safety issue. If there is safety, you take care of the patient first before you deal with your friend who did not do his job. So evaluate the patient. Number 19. What is the appropriate nurse response? Appropriate. For a 5-year-old client with atopic dermatitis, mother asks the nurse about how to decrease skin irritation. Buzzwords. You have atopic dermatitis. How do I decrease skin irritation? That's all. How do I decrease skin irritation? You make sure the lotion you use is prescribed by the doctor. He will tell you specific lotion to use because there's perfumes in some lotions. Fabric softener also has some perfume, so you got to make sure you're listening, you're avoiding certain fabric softness. Warm bath will keep your skin dry, so it's a problem. You should avoid ash soap. Mild soap is good. So that's the way to do it. So 4 is the right answer. And the last one. A nurse is caring for a client with large healing wound. Which of the following the nurse know are required to help with the wound healing? A lot of words. I see wound healing. What is required? That's all. You see, underline only one. Which of this will help with wound healing? Sodium does not do that. It control your water, and that's water control your water system. Vitamin C is needed. It's one of the biggest vitamins in wound healing for collagen and manifestation and lay down. And protein will help with your wound healing. Vitamin E is not part of it. So 3 and 4 are your right answer. Basic care and comfort. This is broad topic. They can ask you anything. I've given you some concept thinking questions to help you. Take care of yourself. If you've not subscribed, look down and subscribe. Thank you for watching this video. All the best. Thanks.